Welcome, listeners. This is Ivan Franklin Rose, and this is the one on how to manage anxiety, part 2. This is an article from thriveworks.com. It is from May 11th of 22, written by Taylor Bennett, who is an expert in love and relationships, anxiety, and self-care, and clinically reviewed by Emily Simonian. Emily is a licensed marriage and family therapist who has direct training and experience working with family and relationship issues, as well as working with individuals. She also specializes in treating stress, anxiety, and depression, and substance abuse, as well as self-esteem issues and general self-improvement goals. So this is from that team, and this is going to be a straightforward guide about anxiety and how to manage it. And then after that, we're going to talk about coping methods. So first, let's get into anxiety. What is anxiety? Well, we did an episode early on, one of the early episodes on anxiety about the fight and flight response and such, but we're going to use their definition now. It's a natural stress response. Is intense fear or worry about the future. You might feel anxious or scared, uneasy, tense before giving a major presentation at work, for example, while waiting for test results from the doctor, or after receiving a text from your significant other that says, "We need to talk." That never feels good. The anxiety comes and goes with high stress situation. So what are the symptoms of anxiety? Well, on top of fear and worry, symptoms of anxiety include a sense of impending danger, nerves and restlessness, a struggling to focus, trembling, feeling tired, headaches, stomach aches, increased heart rate. You may experience all of the above symptoms or just a few. Think about it. We're all different. That means anxiety can look and feel different from one person to the next, too. Is anxiety helpful or harmful? Well, anxiety can be both. In the former case, it can bring awareness to an unhealthy situation that needs to be adjusted. For example, a constant state of anxiety about work indicates something in your work life is off balance. So you may need to work a little less if you work too hard. Have a demanding boss or simply hate your job? Something to consider when considering moving on. Once you realize there is a problem, thanks for the heads up anxiety, and identify it, you can take the right actions to solve it. On the other hand, anxiety can also be harmful. Let's revisit the example above. Your constant state of work anxiety means enduring perpetual fear and worry until you fix the problem. These feelings of anxiety are uncomfortable and can negatively affect your life, for example, making it difficult to sleep at night and enjoy a night out with your friends. So, how can you manage anxiety? A piece of good news is that there are many effective ways to manage your anxiety. Before you skim the list below and write this advice off as basic or overplayed, hear it out. The reason these are so widely discussed is that they actually work. 1. Learn what events or circumstances trigger anxiety. A huge key to better managing your anxiety is identifying what makes you feel anxious in the first place. For some of us, there's a gamut of situations. For others, there are very clear circumstances that trigger thoughts and feelings of anxiety. In either case, just start paying attention. Once you understand what causes your anxiety, you can better prepare for anxiety-inducing situations. Number 2, challenge your thoughts. Remember, anxiety is fear or worry about the future, so another effective strategy for managing, or better yet, alleviating your anxiety, is challenging those negative thoughts. Here's an example. You start to feel uneasy the night before a big work presentation. Soon enough, your stomach starts to flip right on schedule. At moments like this, dig into the stories you're telling yourself that might be contributing to your anxiety, like, what if I forget my entire presentation? Or I know my face is going to turn red and I'll probably sweat through my shirt and everybody will laugh at me. Well, if you've prepared for your presentation, remind yourself of that. I'm ready for this presentation. I'll do my best, tell yourself. And if you do turn red and sweat when you're speaking, don't sweat it. Get it? This is normal, and chances are nobody else will notice. And if they do, they definitely won't laugh at you. It'll be embarrassing for them. 3, start meditating. I know we've talked about meditation before, and it's a big turnoff word for some. But again, it's truly helpful to practice it when it comes to managing anxiety. Now, you don't have to sit crisscross on the floor and meditate unless you want to. The only requirement is that you do nothing. Yes, you read that right. Stop petting your cat. Stop biting your nails. Stop fidgeting. Stop thinking about your to-do list. Stop worrying about making it to work on time. Stop doing. Stop thinking. Easier said than done, but you will get better at it over time. The primary goal here is to quiet your mind, which will free you from these anxious thoughts. Number 4 is exercise. This might be another turnoff, but like meditating, exercising comes with enormous benefits. One being its ability to reduce anxiety. When you're feeling anxious, perform your favorite form of exercise. For some, that might mean going for a run or hitting the gym. For others, that might mean walking the dog or doing yoga in the living room. The key to unlocking the benefits of exercise is to engage in a form of exercise you actually enjoy. Number 5 is journaling. We've also spoke about that before. What do we have here? Another word that possibly you're sick of hearing? Not to sound like a broken record, but journaling is another truly beneficial practice for managing anxiety and difficult emotions alike, they said. When you've had an anxiety-ridden day, or even at the moment you start feeling anxious, take out your journal and write down those thoughts. This does a couple of main things. First, it allows you to vent about those troubling thoughts and feelings. Second, it helps you better understand why you feel anxious or what your anxiety is centered around. You don't have to engage in all of these practices to manage your anxiety. Some might work well for you, others might not. Give them each a try. Figure out what works and what would you enjoy, and then incorporate them into your daily or weekly routine. Next, what is anxiety disorder? Is anxiety a mental illness? It can become one. An anxiety disorder is when anxiety becomes persistent, excessive, and interferes with day-to-day functioning. Fear and worry affect your work performance, your relationships, and other important areas of your life in a big way. These feelings don't go away and may worsen over time without treatment. Fortunately, anxiety disorders are highly treatable. With therapy and/or medication, it is also important to note that they are the most common mental health conditions in the U.S. 19.1% have an anxiety disorder of all humans on the planet. That's right. If you have an anxiety disorder, you're far from alone. So how many anxiety disorders are there, and what are they? In talking about clinical anxiety, there's actually 9 different anxiety disorders. The list of anxiety disorders include, number 1, generalized anxiety disorder, or GAD. It's excessive worry about everyday life events. People with GAD tend to expect the worst and fixate on the disaster that is surely about to strike. And number 2, social anxiety disorder, or social phobia, is irrational anxiety in social situations. Common symptoms include self-consciousness, embarrassment, and intense fear of being judged when interacting with others, or complete avoidance of social interactions. Panic disorder is next. It's marked by panic attacks or sudden feelings of terror and loss of control. Physical symptoms are also common, which include chest pain, shortness of breath, and an increased heart rate. Number 4 is agoraphobia. It's an intense fear and avoidance of places or situations that could make the individual feel trapped, helpless, or embarrassed. The majority of people with agoraphobia develop the condition after having a panic attack. 5 is separation anxiety. It's excessive worry or fear when away from a specific person, pet, or place. It could even involve pets. It's the most common among children who feel scared and separated from the parents, but it can certainly also occur among teens and adults. Phobias are intense fears of a specific situation or thing, such as flying, heights, or spiders. People with phobias avoid ordinary places and activities to avoid confronting their fear. 7 is selective mutism. It's a form of social anxiety where a person isn't able to speak. This occurs in social situations like at work, places and activities to avoid confronting their fear, or at school, or even when you're around unfamiliar people. Substance or medication-induced anxiety disorder is next. It occurs when severe anxiety is caused by the use of or withdrawal from drugs or alcohol. Lastly is number 9, anxiety disorder due to another medical condition. When it's diagnosed, severe anxiety could be caused by congestive heart failure or pneumonia. So which anxiety disorder is most common? Phobias are the most common anxiety disorder in the U.S., affecting 19 million adults, or 8.7% of the population. A close second is social anxiety disorder, affecting 15 million adults, or 6.8% of the population. Coming in at third is GAD, the general, affecting 6.8 million adults, or 3.1% of the population. What causes anxiety? Anxiety can be caused by any stressful event or situation. We listed a few examples earlier. It's common to feel anxious before giving a work presentation, while waiting for test results from your doctor, or after receiving a worrisome text message like we had said before. But you might also feel anxious before getting on a plane, during a presidential election, or after the loss of a loved one, and so on. Outside of the events that trigger your body's natural stress response, certain medications can cause anxiety as well. And as well as alcohol and other drugs besides the medications. So who is at risk of developing an anxiety disorder? Well, anxiety disorders, on the other hand, come with certain risk factors, including personality type. Certain personalities, specifically type A personalities, are more likely to develop an anxiety disorder. These individuals are highly organized, ambitious, and often described as workaholics. When stressed and overwhelmed, people with type A personalities typically engage in unhelpful coping mechanisms like procrastination, or on the flip side of the coin, staying up too late to get something done. Next is genetics. Others are more prone to anxiety disorders simply because it runs in their family. Has a history of GAT or social phobia or other anxiety disorder. If that's in your family, then you're at a higher risk. So if any of those other ones, GAD, social phobia, or any other anxiety disorder is in your family tree from the history, then you're at a higher risk. Other mental conditions, finally, you may also be susceptible to anxiety disorders if you have another mental health condition like depression and vice versa. In this case, it's a harmful cycle that goes both ways. People with depression often experience anxious thoughts and feelings, and people with anxiety disorders often feel hopeless and depressed as a result of their relentless thoughts. The above can be applied to the whole gamut of anxiety disorders listed earlier. There are, though, also specific risk factors for each disorder. For example, experiencing super stressful life events, such as the death of a loved one, puts one at a greater risk of developing agoraphobia. And women specifically are twice as likely to develop several anxiety disorders, GAD, social anxiety disorder, and specific phobias. Can you prevent an anxiety disorder? Well, is experiencing anxiety a common issue? Yes. And while you can't completely prevent anxiety disorders, you can certainly take steps to reduce or manage your anxiety. Refer to the section here called How Can I Manage My Anxiety? We share a few effective strategies identifying anxiety triggers, challenging negative thinking, meditating, exercising, and journaling. So, how are anxiety disorders treated? If there's anything you take away from this guide, we hope it's that anxiety disorders are highly treatable. There are 2 forms of anxiety treatment specifically, and then a third one that I'll add. The first is therapy. Anxiety therapy involves talking to a therapist about your anxiety symptoms, potential causes, and more. They can help you better understand and manage it. The most common and effective form of therapy for anxiety is cognitive behavior therapy, CBT. This is typically short-term and involves learning specific skills for reducing your unique anxiety symptoms and getting back to normal life. A subcategory of CBT is exposure therapy, which is also highly effective and involves exposure to the event or object that causes your anxiety. The goal here is to gain confidence in those situations or around the given object, lessening your anxiety in the process and improving your ability to manage it. Medication. Medication, like anti-anxiety medication and certain antidepressants, can also be used to treat anxiety and helps to alleviate symptoms. Oftentimes, people with anxiety will take medication, depending on the type and severity of their anxiety, in conjunction with attending therapy. Once they make progress with their therapist, they may go off medication, as they may better be able to manage their anxiety with the techniques they learned in therapy. Now, I add a third one. I mentioned it in episode 11. You can refer to it in more details, but nutrition. With some people, lack of certain nutrients can cause low serotonin and other imbalances that can produce anxiety. So if you listen to that episode, number 11, you'll hear more about things that you can take that might work. Will anxiety eventually go away? Well, while anxiety isn't curable, it is treatable and manageable. If you're struggling with anxiety, be it the normal day-to-day anxiety or a suspected anxiety disorder, reach out to a medical professional to talk through the treatment options above. Through therapy and or medication, plus our anxiety management tips, you can cope with and lessen your anxiety. What was once a major impediment in your day can shrink in the background. So that is their thoughts on that. And we'd like to now, talking about coping, to that end, here are some healthy coping mechanisms and strategies that you might be interested in. From an article, let's see when this was. This is an article on December 1st of 22, written by Jason Crosby. Again, this is on thriveworks.com, and clinically reviewed by Christine Ridley, who is an IC, an LLCSW. So let's start at some behaviors that can set you up for success. So, number one, they talk about coping strategies, referred to interchangeably as coping mechanisms or coping skills. Refer to them as behaviors that are designed to help us reduce the negative emotions associated with difficult events, situations, relationships, and more. Coping mechanisms. Now, let's see. All right. Coping mechanisms may be learned both consciously or unconsciously. Learning and implementing healthy coping strategies is a routine part of successful mental health treatment, and as a result, discovering new coping strategies are often assisted by a provider. But some healthy coping strategies can also be self-taught, particularly simpler behaviors or habits we can adopt to help maintain our mental and physical health. What are coping mechanisms? As explained above, coping mechanisms are the strategies that people often use in the face of stress or trauma to help manage painful or difficult emotions. Coping mechanisms can assist us in handling our stress, anxiety, and more by offering ways to maintain or even improve our emotional well-being and ability to function. It is also important to make the distinction between positive and negative coping strategies. Even though both seem to reduce negative emotions, they both try to, only positive coping strategies help guide us towards long-term well-being. More on these soon. In comparison, negative coping strategies only help us temporarily escape unpleasant feelings in the short term, but then leave us feeling worse off later. So unhealthy coping mechanisms might include substance and alcohol abuse, lashing out physically or verbally, destroying objects or personal property, stonewalling, impulsive shopping, trauma dumping, social withdrawal, including becoming isolated from family and friends, avoidant behavior, ignoring dysfunctional behavior or bad habits, oversleeping. These unhealthy ways of coping may even develop unconsciously, and sometimes we aren't fully aware of their effects until we have the guidance and insight of a mental health provider or continue to mature and develop. So what are positive coping strategies? Positive coping strategies and mechanisms are designed to help us healthily adjust and respond to changes in our lives. Positive coping strategies are often a core component of different therapeutic methods, especially psychotherapy approaches like cognitive behavioral therapy, CBT, and dialectal behavior therapy, DBT. Other techniques such as acceptance and commitment therapy, ACT, or mindfulness-based cognitive behavioral therapy, MBCBT, also rely on the implementation of positive coping strategies. Positive coping skills differ from subconscious or unhealthy coping strategies in that they help us respond productively to difficult situations or people at work, at home, or in public, the effects of different mental health conditions such as anxiety or depression, unconscious habits that are creating negative outcomes, the challenges and setbacks we might face while working towards long and short-term goals. So healthy coping strategies can be separated into different groups based on the nature of the coping strategy itself. They are often broken down into the following 5 distinct categories. 1, social support. This type of coping mechanism is all about seeking out resources and support provided by a social network to help us cope with stress of all kinds. Social support may take the form of financial aid, cooking meals, helping someone to relocate, or someone simply lending a friendly ear when we need to vent. Next is problem-focused coping. This coping focuses on changing specific situations, sometimes by directly removing stressful things from our lives. For example, the problem may be an unhealthy relationship, crushing anxiety, or depression. Problem-focused coping helps us start making positive changes. You have to put you first. You have to take care of yourself. So look at everything going on in your life and see if this could be part of it. Spiritual coping is next. A somewhat broad term, this type of coping mechanism encompasses spiritual and religious responses to grief, stress, anger, and many other unpleasant emotions. Religious coping may be used to help empower us to overcome unhealthy habits or thought patterns that go against our spiritual or moral compass, as well as make sense of tragedy or loss for us. Next is meaning-making. This coping type is related to the process of reevaluating situations to find a more positive understanding of the factors at play, the outcome, and the lessons that can be learned from past failures and other scenarios. Lastly is emotion-focused coping. This form of coping helps manage emotions when we don't want to change the situation or when the circumstances are beyond our control. A good example of this would be processing the grief created by the loss of a loved one. It wouldn't make sense to turn off our grief, nor can we bring the loved one that was lost back. Instead, we give ourselves the time, space, and understanding to grieve and do our best to realize that the difficult emotions caused by the event will pass. These 5 types of coping strategies all share one thing in common. They're the basis for healthy coping strategies. What are 6 examples of healthy coping strategies? Basic healthy coping strategies and mechanisms are often synonymous with many self-care activities. However, they differ in the way that they're used. Healthy coping strategies are seen as tools to reduce feelings of overwhelm in the moment, while self-care strategies are primarily preventative in nature. Healthy coping strategies for dealing with anxiety, anger, stress, and other emotions include exercise, which has been proven to help fend off the effects of many mental and physical health conditions, following a healthy diet, something that's been shown to support long-term mental health, and of course we talked about nutrition helping with anxiety and depression in episode 11. Meditation, which can be used to identify harmful thoughts, work through unpleasant emotional states, and more. Next is talking through difficult emotions and situations with a loved one. as a way of letting off steam, hear advice, and request support when it's needed. Identifying and replacing harmful thoughts is next, a way to prevent difficult emotions like anger, fear, or anxiety from building, also known as cognitive reframing or restructuring. And next is assertive anger, using assertive anger during interpersonal conflicts, a way to resolve angry thoughts and feelings without building. Also, anger, fear, or anxiety from building, keeping it from building, also known as cognitive reframing or structuring. So, all right, let's talk about this. There's a difference between aggressive anger and assertive anger. So aggressive anger, which is what a lot of people do when they're letting out and lashing out at people, this is the most infamous and perhaps the most tangible destructive type of anger, direct aggression. This type of anger occurs when a person expresses their anger outwardly and uses these tactics to control a person or situation. This is typically a fight or flight response to external threats, whether real or imagined. Directly aggressive behavior can involve physical violence, intimidation, verbal abuse, or even the smashing of objects. So this is what you don't want to do. You want to use the tool of assertive anger. Okay. This type of anger occurs when a person attempts to communicate needs and feelings during a triggering situation in a controlled manner. Assertive anger is the least harmful of all three forms, and it's what clients seek to transform their unhealthy expressions of anger into. This response is the healthiest way to express emotional displeasure. Assertive anger may involve verbally addressing a perceived slight, comment, or action that bothers a client. The key difference between assertive anger and other forms of anger is that it's not aggressive, but rather constructive. So that's important to know as a way of helping your coping strategies succeed. And lastly is practicing good sleep hygiene, which involves ensuring that we stay well rested and position ourselves in the best way possible to get a good night's rest, excluding, of course, caffeine before bed, limiting blue light exposure from electronics in evening hours, or gentle stretching. That's a given. Progressive muscle relaxation and placed breathing exercises are also a great way to wind down before bed. As our mental health awareness and ability to respond productively to stressors improve, we may also get better at using healthy coping strategies to improve our emotional and physical states. So with a therapist, counselor, or life coach's assistant, we can also learn more specialized coping mechanisms, strategies that are specifically molded to address our personality traits, life experiences, relationships with others, and the world around us. So what are coping skills? Life coping skills can refer to mechanisms that help us adapt and readjust to conflict, communication issues, trauma, or cross boundaries in our everyday life. Determining what life coping skills are needed may begin with a candid conversation and with a mental health professional. Our individual situations and reasons for seeking counseling usually determine the nature of the life coping skills we need to implement. A provider can also screen for undiagnosed conditions or disorders if necessary. Some conditions, such as borderline personality disorder, BPD, make it extremely difficult to trust other people. So learning to respond patiently and without anger could be essential to maintaining healthy relationships. For someone working multiple jobs or who is dealing with difficult coworkers or bosses, the life coping skills they need might revolve around avoiding or healthily addressing interpersonal conflict and feelings of burnout. Please refer to my episode on burnout syndrome in my list. So general examples of life coping skills would be walking away from an argument or disagreement to cool off, learning to express emotional displeasure in a productive way, learning to say no to avoid overextending oneself with too many obligations, setting boundaries with loved ones, accepting the faults of others, setting realistic expectations for oneself and others, learning to avoid financial stress by reducing impulsive spending habits. Life coping skills usually focus on personal relationships, financial or educational goals, and other abstract concepts. So what are physical coping skills? Physical coping skills are physically active mechanisms that can be used to blow off steam and remain emotionally grounded. They can also help us to prevent emotions or situations from escalating, stimulating the body in order to allow the mind to focus on something other than the source of the stress and anxiety. So physical coping skills can involve deep breathing, mindful stretching, walking meditations, eating healthy, well-balanced meals, exercising regularly, avoiding excessive use of alcohol, tobacco, or other substances, bonding with an emotional support animal or pet, spending time in nature, engaging in physically intense activities such as martial arts or weight training, and finally, I added one myself, which is going to anger release room where you break plates, glass, etc. to let off steam. You've seen these where you go in, you pay for whatever you break, but you go in there and you can smash things, throw things, let out your hostility, your anger, and then it's done with. So that's a good thing. Okay. And then some providers even are trained to help individuals spot the physical signs of tension that may be hidden, such as clenched jaw or stiff neck, helping to improve the effectiveness of physical coping skills. So what are 3 simple ways to set yourself up for successful coping? The best way to improve your ability to cope with the hurdles and obstacles of daily life is to confide in a counselor, therapist, or psychiatric provider. But the initial steps can be accomplished on your own, with or without their assistance. When we feel stressed or overwhelmed, it's tempting to neglect important issues and areas in our life and zero in on our problems with excruciating detail. But in doing so, we may reduce our ability to cope with change and forms of conflict. And most importantly, we may block ourselves from the coping strategies we need to access in order to start fixing the issue at hand. So 1, maintaining good relationships to ensure you have social support is important. Stay close with your family members, friends, and coworkers if possible. Remember to accept help and support when it's needed and to offer to assist others too. Volunteering our time to help others has been shown to offer unique mental health benefits and offset some of these detriments we've been talking about earlier. It can improve quality of life. Just don't overbook yourself. Doing your best to replace those negative thoughts with more positive or neutral ones is next. Not every problem is insurmountable, nor is every crisis unsolvable. Even if it is difficult, it's still possible to preserve hope for the future and turn your present moments into opportunities to find humor, positivity, and grace in our human errors and shortcomings. Lastly, visualizing yourself achieving your goals. Used in meditation, yoga, and certain forms of therapy, visualization is something that the brain is already well equipped to do. According to science, you can use visualization to your advantage, whether it's imagining yourself confidently asking for that raise, picturing yourself finally saying no to a master manipulator, or walking through the doors of a new gym after a long hiatus. Visualization can be a helpful confidence booster, according to science. For better or worse, life will give us plenty of opportunities to develop healthy coping mechanisms. And as we learn more about what healthy coping truly means, we tend to learn more about ourselves as well. Sometimes the best we do with a stressful situation, is to view it from a broader context and to patiently begin unraveling the knots. But with healthy coping strategies up our sleeve, we get the chance to maintain an optimistic outlook, even when it seems like the odds are stacked up against us. Well, there you have 5 types and examples of strategies, lots of coping mechanisms that might work for you. I hope that you get a chance to practice some of these and go over and listen to this again. And in your life, when things happen, remember you're not alone. You have help. There is therapy. There are other ways of treating things. And just try to work out some of these tools in your head to make it easier for you to get through it and get on with whatever else you're trying to do in your life. We all have anxiety. We all have stress. It's how we process it. It's how we choose to let it affect us. And sometimes the brain doesn't give us a choice, but other times we may have the ability to use these tools. Until next time, I hope you get a chance to wake up each morning with a smile and have a happy day and cope with whatever is troubling you at the moment. Goodbye.